Hi, my name is Maria Brazel, and I'm a PhD student at Capella University. I am completing the assignment for Unit 8. This is going to be a presentation about the shaping of novel behavior. For an example video demonstration, I'm going to use an adolescent dog to show how to shape a novel behavior in a live subject. So just a description of shaping. Shaping according to Rosales and Ruiz 2020. Shaping is a use of differential reinforcement of successive approximations to a target response. It's been a cornerstone procedure for the training of novel behavior, especially in animals. Skinner describes shaping as a process by which new behavior is formed through trial and error. So not looking at discrimination or antecedents. In Skinner shaping, it's the researcher or therapist who takes an active role in setting up the situation in which the participant will systematically change their behavior and respond to evolving contingencies of reinforcement. With shaping, it's important to reinforce every correct response immediately. That immediacy is very important. This is why using something like the clicker, as Skinner did with the pigeon in his experimentation, is very beneficial. This way, the participant is getting automatic feedback each time they demonstrate the desired target response. Further, the clicker helps to build a clear stimulus and mark the behavior that is being targeted. So with each response that we want to see, we can automatically mark and reinforce that behavior. So it's very clear that the stimulus is being connected to that behavior. There are a few different case studies that I looked at for the purposes of this presentation. The first one was using shaping in children who have food aversions, children with autism, by Turner et al. 2020. So this looked at two boys with ASD who had severe food selectivity. They had a very small food repertoire. They identified possible reinforcers. They used shaping through a process of exposure and reinforcement for successive steps, as we would see typically with shaping. So both children did reach mastery criteria. They were able to sample a very wide variety of foods. They expanded their food repertoire quite dramatically. One child was even able to eat a novel food that hadn't been tested or trained on for a generalization probe. It focused on shaping through approximations that started with presentation of the food, then it moved to touching the food, tasting, licking, inserting the food into the mouth, and then ultimately eating the food. So the foods that were targeted initially were eggs and pasta, which were somewhat similar to other foods that the children were eating at the time. Later generalization trials focused on building the food repertoire, showing novel foods. They were each able to reach between 11 and 17 different foods, and it took between 60 and 79 sessions for the boys to reach mastery with this procedure. Case example number 2 looks at eye contact for children with autism. So for this study, there were 3 children who were diagnosed with autism spectrum disorder. Reinforcers were identified prior to starting the procedure. Again, successive steps were reinforced for responses toward the terminal goal. All 3 children were able to quickly attain the eye contact that they were looking for. So the shaping in this procedure, it looked at initially just body orientation, so getting the child to orient their body towards the researcher, eventually facial orientation, sustained eye contact for up to 3 seconds, which was the goal for the eye contact. And then eventually they moved to generalizing to novel researchers or therapists. And all 3 children were able to reach that goal of generalization to novel people. And they also were able to fade that reinforcement over time. Case example number 3 which is more similar to the procedure that I'll be using in my video example, is training sheep for a petting zoo. So there were a sample of 2 sheep who did not want to engage with people in the petting zoo, which is quite important in the petting zoo. They would run away from people whenever they entered the corral. So this is from Fernandez 2020. Looking at using food reinforcers and negative reinforcement. So the negative reinforcement is the removal of the people. They used a fixed time 1 schedule of reinforcement to reinforce the successive approximations. And the intervention was successful in both sheep for increasing approach and contact responses while decreasing avoidant behavior. Both sheep ultimately were successful in meeting those goals. They did use a multiple baseline design to track the rate of undesired behaviors as well as eating from the hands of the researcher. They did use clicker training for this to mark the behaviors and shape that desired behavior. Success in the study was gauged ultimately by the sheep approaching the people when they entered the pen, as would be expected in that setting with the visitors. So the researchers started reinforcing the sheep for staying in proximity. They would throw food to them, pairing with the clicker, and then over time decrease the distance from the sheep, and eventually letting the researcher touch the sheep and generalizing this to novel people and then more people in the setting, as typically there are multiple people in that petting zoo setting. So that's what they were ultimately looking for, and they were able to reach that goal with the sheep. So now I have a video example which shows me shaping a novel response in my pet dog. His name is Boo. I use Skinner's shaping procedure with the clicker training. However, in the video, it is hard to hear the clicker. You can only hear it sometimes. I think this is because the clicker is in my pocket. The clicker it was loud, so it tends to startle him. So I put it in my pocket, reach over. Anytime you see my hand over on my hip, I'm clicking the clicker. So anytime I give a food reinforcer, the clicker happens first. You just might not be able to hear it as well. So every time he engaged in the target response or that approximation towards the goal that I wanted him to do, the clicker and the reinforcement were given. I used a procedure specifically outlined by Rosales Ruiz, and the terminal goal for my dog is to do a high five. So you will see that now.
Okay, so now I'm going to demonstrate clicker training and shaping a behavior with my dog, High Five. He's familiar with the clicker and he is trained in some other commands, but the High Five is a novel command for him. Okay, so I'm going to start with getting him up. He's sleepy. You want this? Making sure that this is something reinforcing for him. Come. Good boy. Sit. Good boy. So now I'm going to do the high five. So I'm going to start with presenting, after he's done chewing, presenting the treat in my hand. And I'm going to reinforce as soon as he gets his paw on my hand. Close. That was close. Getting a little bit in the area. Not from my hand. Okay, I'll show him that it's there. Close it. Show him again. Try to establish that motivation. Now he's not understanding. At this point, even if he accidentally touches his paw on my hand, I'll still reinforce. He's doing a lot of sniffing. Trying to figure it out. Almost. Oh, touched my finger with his paw there. He's getting it. He's trying some other responses. See what that gets him. Give it a little delay. That's a good boy. Try to catch that one. That's a good boy. Yes. You're so close. You're so close. We'll try to get him up. Buddha. Oh, now he's heard a noise. Let's give him a minute. Okay, he's back. All right, ready? Sit. Good boy. Ready? Snip in the hand. Okay. And now he's trying to figure out what is it that I'm asking him to do. Not quite getting it. That's a good boy. That's a good boy. He did it. He reached down independently that time, touched my hand. That's a good boy. That's a good boy. Wonderful. So we're checking it up. He touched my hand. We'll do a few more trials of that. That's a good boy. That's a good boy. That's a good. Sorry, that's how I talk to my dog. I use a very funny voice to reinforce him. That's a good boy. That's a good boy. So now he's doing it before my hand's even over to him. So we've shown a pretty strong master of that. We'll do the high five. We'll work on getting them up there. Oh, nice job. Very good. And I actually mistimed the clicker. I clicked it a little bit too soon. So I'll be more careful this time. That's a good boy. Very good. Very good. You can see that he's doing a high five. Maybe I'll turn him a little. You can see he's got it. Ready? Very good. High five. Now that he's doing that independently and quickly, we'll pair it with the instruction. He's getting clicker trained. That's how we do the clicker training. We've shaped that behavior. High five. Very good boy. That's a very good boy. That's a good boy. That's a very good boy. Now we'll do one more. High five. That's a good boy. There we go. That's a good boy. And that's it. We got him to that terminal response by shaping up smaller successive steps up to approximations to what I was looking for him to do.
So with that, you can see that the dog was ultimately able to reach the target response. It did take some time for him to figure out what behavior to engage in. He did some laying down, which is a typical response for him when he's learning a new skill. He'll lay there and try to figure out what it is he's being expected to do. One of the skills in his repertoire is rolling over, or playing dead. So he sometimes will try to do those things to get a reward. So it was shaping him to that response of paw on the hand, then ultimately having him reach up to give the high five. And these are the references I used throughout the study to help improve the procedures that I use. You can also see these referenced throughout my video dialogue document. Thank you.